My name is Catherine Bira Promise. I am the chairperson of the Sexual Health Improvement Project. I've grown up in this society seeing the problems that young people face. And during that training, one of the activities we were asked to develop was to write a proposal on how we would use the skills that we got in Israel when we go back to our home countries. So when we returned to Uganda, we started looking at what we had written and said, okay, what can we possibly do? But we wanted to get information and skills out there to young people. How do we do it? So we started by going around schools in Kampala where we work and speaking just to the students whenever we could. And then in 2008, I think it was 2008, we had a reunion of all the people who were trained, the 6 Ugandans and about 24 Kenyans. And there we reported what we had done. And at that time, we reported that we thought that if we can get this project beyond just the SHIP team, which was based in Population Secretariat, give the skills to other people in the communities, it would be an easier way of getting the message out there. And so we discussed this, and at that time the Israeli ambassador to the region pledged to support trainers, 3 trainers who had trained us in Israel, to come and train alongside us to do the first training of that kind, where we would take the skills from our group as the people who are trained in Israel to people based in the community. And so that is how SHIP was born. So we have had 3 trainings so far, one in Rukunjiri district, the other in Masindi district, and this is the 3rd training in Ngora district. If I were to estimate, in Rukunjiri district we have, for example, 56 sexual health educators. Looking at the 30 we have trained in Ngora, each sub-county is represented. Looking at the 56 of Rukunjiri, each sub-county represented. Looking at the 32 of Masindi with each sub-county represented, we have the potential to reach really thousands and thousands of. The main difference that I think these people will bring, one is they come from different backgrounds in terms of professional training. The teachers, yes, are trained teachers. Here in this group we have people who are health workers, who are more comfortable to explain intimate issues of sexuality than the teachers. 2, it is, I think, also the charisma that these sexual health educators bring. They come on board committed to serve voluntarily, so they are driven by passion and a cause. The 3rd thing that I think the sexual health educators bring that you wouldn't see in the teachers is the approach. The way they are imparting the skills and information is fun. It's using games, it's interactive, it's allowing students to speak up while having fun at the same time, and allowing for them to openly express themselves, and even being able to confide in these sexual health educators.